too long, the narrative of African healthcare has been one of challenges. Limited access, insufficient specialized care, the costly exodus of our brightest minds, and citizens seeking treatment abroad. The time has come for us to have world-class medical facilities on our own continent to stop medical tourism that's costing the continent billions of dollars annually. Afreximbank, who sits at the heart of this ambitious project, are not just committed to trade, but to the holistic development of Africa. We sat down with Ms. Oluranti Doherty, Managing Director of Export Development, to understand the strategic vision behind this monumental investment.
It came about in 2014 when we undertook a study of the healthcare landscape. We also undertook a study of what is the reason for outbound medical tourism on the continent and why our member countries, our 54 member countries, expending a lot in terms of foreign exchange outflows from the continent. And based on our studies, everything pointed to one thing. A lot of our member countries were expending up to $7 billion annually on outbound medical tourism, depleting their scarce foreign exchange resources. So we said to ourselves, we were going to set up to create regional centers of excellence. So we set out to establish regional centers of excellence that would provide the best in world-class treatment for non-communicable diseases and will stem this outbound medical tourism across our member countries. And that's why we are playing in this role. As you know, in line with Afreximbank's mandate, we are expected to promote intra and extra-Africa trade.
The AMCE is planned as the first in a network of centers across Africa. This Pan-African ambition is crucial.
We decided that Abuja will be the pilot, a proof of concept, to show that when Africans indeed put our heads together, cooperate with each other, partner each other, we can solve most of our problems ourselves.
Stepping inside the AMCE, the scale and sophistication are immediately apparent. This isn't just a building. It's a meticulously designed environment focused on patient comfort, advanced technology, and operational efficiency. We walked through the facility with the CEO.
Well, we have obviously a number of technologies here that distinguish us from other facilities. We're a specialty hospital, not a general acute hospital. And so from that standpoint, it's very easy to say we have this and we have that, and other hospitals don't. But the real defining distinction is our people. So when you look, number one, at the specialists that we've recruited globally. And in many cases, for every role that was advertised, we got 1,000 applicants. And we were fortunate in that we were able to pick the very top, cream of the crop. Afreximbank looked at what the gaps in care were for the area. That drove what the investment in technology was going to be. And so we knew that if we were going to truly make an impact in those three critical specialty areas, we were going to have to match that technology to the need. Now, in addition to that, and of course, as we've talked about for really a couple of years, that investment is going to come close to reaching $300 million for this first phase. But part of the investment goes beyond the investment in the initial procurement of the equipment. What's really critical in Nigeria is investing in the ongoing upkeep and maintenance, service agreements of the equipment. There are many, many great pieces of technology throughout Nigeria, and unfortunately, many of them aren't functioning.
Beyond the machinery, the patient journey is paramount. From admission to recovery, the AMCE aims for a seamless, patient-centric experience. A hospital, no matter how advanced, is only as good as its medical staff. The AMCE is focused on attracting and retaining Africa's top medical talent.
We invested a lot in human beings who are going to drive these machines. So as an example, in the radiotherapy department, we have the best Linux with AI equipments, with integrated real-time imaging, so we can follow the tumor real-time, even if the patient is breathing, with sub-millimeter accuracy, and the machine can target where we can shoot. So in terms of how we are going to tackle, it's very well-trained physicians, nurses, and allied health professionals, and cutting-edge versatile technology.
Beyond treatment, the AMCE also aims to be a hub for medical education and research, crucial for long-term healthcare development.
So we have gone to great lengths to ensure that we recruit qualified personnel wherever they are. Now we brought them here, our job is to make sure they stay. How would we do this? By ensuring we maintain the standards of service that is available, comparable to anywhere else, and we would be involved in research in collaboration with other healthcare institutions. We have plans for training of our staff to maintain their skills, upskill those who don't have, and we have plans to have a medical school as well as setting up a postgraduate training program in Nigeria for medical officers, residents, and postgraduate studies.
The African Medical Center of Excellence is not the first purpose-built hospital on the continent, but its unique model, driven by a developmental financial institution like Afreximbank, sets it apart. While other excellent facilities exist across the continent, from specialized clinics in South Africa to advanced hospitals in Egypt or Morocco, the AMCE's distinct approach lies in its Pan-African ambition, its focus on repatriating medical spending, and its commitment to becoming a training and research hub for the entire continent. It is designed to be a catalyst for a new era of medical self-sufficiency.
Essentially, what I think has happened here is that now you have built for the first time a comprehensive tertiary hospital with the desire to manage 3 specific disease types. And these 3 centers of excellence are common diseases which affect us, and people are commonly leaving the shores of Africa to get this treatment abroad: cardiology, hematology, and oncology. All 3 are on the rise. And all 3 require significant investment in infrastructure apart from human resource to see that you can get clinical capacity into the continent. And that's where I think AMC comes in. We're one monocoque building, 7 floors, tight, contemporary, built on the standards of what you would have in the West. Some places we're better than them with respect to our lab services, radiology services. So yeah, there's a lot which I think we've brought into one tight package as AMC.
This ambitious $300 million plus project is a testament to significant partnerships. Beyond Afreximbank, investment partners like the Bank of Industry and the Nigerian National Petroleum Corporation Limited have thrown their weight behind this vision. Crucially, strategic partners such as King's College London and Christie's Manchester are lending their world-renowned experience to ensure clinical and operational excellence, elevating the AMCE to global standards.
John, a lot of people have looked at this facility and said to me, are we just serving the rich? Are we just focusing on people who can just jump on the plane and get out of the country? Absolutely not. African Medical Center of Excellence is going to work across board to ensure that their services and their care impact everybody, including the medically vulnerable in our society. And one of the mechanisms we are using is to explore and deepen our partnership. In March 2025, the board of Afreximbank approved the establishment of the Africa Life Sciences Foundation. This foundation was seeded with 75 million over 3 years from Afreximbank. And one of the purposes of the Africa Life Sciences Foundation is to ensure that the medically vulnerable, not just in Nigeria, but across the continent, can continue to access good quality medical care to support them. And we'll be working with a lot of partners.
The launch of the AMCE is more than just the opening of a hospital. It's a powerful statement that Africa is capable of delivering world-class healthcare. Yet, the true measure of success extends far beyond the impressive architecture and cutting-edge equipment. It's one thing to build a purpose-built hospital. It's another entirely to build one that truly succeeds. Success for the AMCE will be defined by its ability to consistently provide exceptional patient outcomes, to innovate in research, to stem the tide of medical tourism, and ultimately to sustainably transform healthcare for generations across the continent. With strategic investment and unwavering commitment, Africa stands poised to write its own story of medical self-sufficiency. Leila Johnson Salami. Arise News, Abuja.